I'm Gabby. I think I hope I've met everybody by now. I'll be talking about workplace violence. First of all, we're gonna take a quick look, kind of like the overall numbers, and then we're gonna briefly touch on like who's at risk, where does it happen, what are some consequences of it, what are some risk factors for it, and then some options to prevent it. Okay. So first of all, the National Institute of Occupational Safety and Health defines workplace violence as violent acts, including physical assaults and threats of assault, directed towards persons at work or on duty. Healthcare workers are especially vulnerable to workplace violence. That's why it's actually been a topic of concern in the US for decades, even though we might not necessarily feel that way. A lot of the literature is actually pretty old, so I'm going to try to focus on just the more recent numbers. And then, like with many topics, there are some issues with the literature. So, for example, different definitions of what violence is, as well as the fact that a lot of it relies on surveys, which ask people to recollect things in the past, which is not the most reliable. And then the other thing is that a lot of it focuses on trying to quantify the problem, which is good, but at the same time, rarely anything actually tries to show any results about possible solutions for it. Okay. So in 2018, the Bureau of Labor Statistics showed that in private sector, non-fatal occupational injuries that were a result from intentional injury towards an employee in the healthcare, specifically in the healthcare sector, the risk was 10.4 incidents per every 10,000 full-time employees, compared to overall in the private industry in general, it was 2.1 for every 10,000. So much higher, 5 times higher, in fact. And that's what we show in the first chart. The second chart on your right shows actually the days off as a result of these injuries. In the red, it's the days off for people in the healthcare industry versus the blue is for overall. So who's at risk? Unfortunately, everybody's at risk. The only thing is that nurses and aides who spend most of the one-on-one contact time with the patients are at highest risk. Speaking specifically about doctors, in 2005, the Michigan College of Emergency Physicians sent out a survey. That one was specific only for attendings, to assess the incidence of violence in the workplace. They actually sent out the same survey again in 2018 to compare if there had been any changes in between the two time points. So they didn't find any change in the overall incidence of violence in the workplace between the two time points, but unfortunately, both times it was pretty high. With 76% in 2005 and 72% in 2018. They found, in addition to that, that verbal threats were the most common type of violence, which the incidence didn't change between one time point and the other. And then that was followed by physical assault, which unfortunately did increase from between 2005 and 2018, with an incidence of 28% versus 38%. It's interestingly, that same article showed that participants reported being more concerned constantly and frequently about workplace violence in the 2018 survey compared to the 2005 survey. Another survey, because most of this comes from surveys, this one actually included residents and attendings of emergency residency programs throughout the country, showed that more than 3/4 of participants had experienced at least one episode of workplace violence in the past year. Again, verbal threats were the most common, followed by physical acts of violence. In addition to that, I know I was focusing mostly on the doctors because this is the main audience, but also I wanted to mention that, not surprisingly, a study looking at emergency room nurses also showed that about over 50% had been victims of physical acts of violence, and over 70% had been victims of verbal acts of violence in the previous year. So why is it so difficult to quantify the problem? I gave you some numbers, but those surveys, for example, had responses of in the 200s of participants. So even though it gives us numbers, they're not perfect numbers. So part of the problem, as we might have talked about a little bit in the previous slides, is the definition of workplace violence used by different people. So for example, we talked about how the most common act is verbal threats or verbal assault. But for example, those numbers from the US Bureau of Labor Statistics were just specifically for physical assault. So that's an example of part of the issue with quantifying the problem accurately. Another problem is reporting. So this article actually was a survey sent to nurses, and these were nurses working in the emergency room, the ICUs, and just the general wards. And this study found that only about 50% said that they had ever reported an incident in writing, like as a formal complaint. Some of the barriers that they identified as to potentially reporting were a perception that there would be negative effects in terms of service surveys or scores, ambiguous reporting policies in the facilities, fear of retaliation both from the employer or patients or other employees, a perception that it's a sign of incompetence or weakness, lack of physical injury, because like, for example, like I mentioned, a lot of it is verbal, an attitude that violence is just something that comes with the job, and then also feeling lack of support from administration or management. So those numbers were for nurses. Now, looking at it in terms of physicians, going back to that same survey that surveyed both residents and attendings, their report rate was around 15%. And then the paper, the survey that looked at attendings only in Michigan reported 17.5% in terms of reports. So just kind of not great numbers in general in terms of reporting. So where does this happen? So it can happen anywhere, but the major places that are at risk are the emergency room, waiting rooms, psychiatric wards, and geriatric units. And the emergency room is uniquely vulnerable because of basically what our job entails. We're seeing a lot of patients, a lot of families. We're dealing with people in pain. We're dealing with people who are getting bad news. We're dealing with people who are waiting for long periods of time and in an uncomfortable setting. So it just kind of puts it as makes it an area with a higher risk. So some of the effects of workplace violence. They can vary, they can range in intensity and severity, from things like minor or serious physical injuries that can lead to temporary or permanent disability, psychological trauma, lost wages from missed time from work, burnout and poor work satisfaction, and then the most serious of all, death. These were more thinking of individual consequences of work, of being of suffering workplace violence, but it can also have an effect on the institution as a whole. And that can lead to low worker morale, a lot of worker turnover, reduced confidence in employers and management, hostile work environment, decreased productivity from employees, and then also something that is very important to us, decreased quality of patient care. So some risk factors for violence. They're going to vary from one hospital to another. It's going to depend on where the hospital is, the size of the hospital, what kind of services they offer. But some common risk factors, we can kind of divide them into some categories. So starting with the physical environment, so kind of the design of the environment itself and how it flows, how the areas are divided. Poor lighting in different areas, access to arms or things that can be used as arms. Some other factors are more related to like task specific. So transporting patients is particularly vulnerable, working alone. And then working directly with volatile patients, such as, for example, people who are intoxicated with alcohol or drugs. And psychiatric illnesses as well. And then thinking of risk factors more related to administrative things that can happen. So being understaffed. So working in understaffed conditions is an important one because the people are waiting longer, they're uncomfortable, they're angrier, long waits, overcrowding, both in the emergency room itself, but also in the waiting area, because like we saw before, the waiting room is one of the more the places that are mostly affected. And inadequate security, poorly enforced visitors policies, and lack of training for staff in terms of identifying potential violence and dealing with it when it happens. So what can be done? Unfortunately, the Occupational Safety and Health Administration, OSHA, doesn't require employers to have a workplace violence prevention program. It does provide some voluntary guidelines, and they can technically cite an employer if they don't, they're not able to provide a generally recognized environment free from hazards, but that's very vague language. So it's a little bit hard to know what exactly can they do to cite somebody. In addition to that, legislation does exist in some states, but not all, where battery against a healthcare worker is a felony. So that could also use some improvement. So to address the need for better laws and programs, different unions and professional organizations have been advocating to the federal government for federal regulations on this. And this brings me to an example, which is you might have seen in your email in the last few months, an email from ASAP asking for basically polling to see how frequently people have been victims of workplace violence, and also asking people to actually provide testimonials and things like that that they can use for the advocacy work. Sorry. Then going back to like more local prevention strategies. So hospitals should develop a safety program. The safety program should be developed working between the administration and employees. It should identify the hazards, create a plan for it, and train people on it. And then after that, you also have to periodically test that it's working. Okay, this isn't unique to plans against workplace violence. It basically kind of applies to every plan that you implement. So some, in general, different articles and government agencies have some recommendations overall, although everything will vary depending on the needs of a facility. So regarding, again, kind of the same buckets that we used before, in terms of the physical environment, they recommend using security devices such as metal detectors to prevent people from from entering facilities with weapons. They also recommend cameras, good lighting. They recommend things like security escorts to parking garages and things like that, especially late at night. They recommend, they emphasize a lot waiting areas that are comfortable and can accommodate the large number of people that waits to avoid overcrowding. They also recommend enclosed nursing stations, deep service desks or desks that have bulletproof glass or shatterproof glass in service areas, and also arranging furniture in a way where the likelihood of it being used as a weapon is reduced. In terms from the administrative standpoint, they talk about staffing patterns to reduce wait times and minimize personnel working alone. And they also, they also talk about hiring security personnel and mental health personnel. The other thing they mention is chart flagging systems. And then finally, in terms of behavior modifications, all the different sources emphasize programs to help teach employees how to identify potentially violent situations and how to manage them. Like I said, there aren't many studies in terms of the techniques to help reduce violence, but there are a few studies that do say that there people who have been trained just suffer less events. And then just in general, of the entire presentation, if there's something you remember, it's kind of some of the things that I want to mention now, which are just safety tips overall for everybody. So watch out for signals of potential violence, which verbal expressions of anger or frustration, body language that is threatening, signs of intoxication with drug or alcohol, or any potential weapons. Be alert in any situation that you enter. Always don't isolate yourself alone with anybody, and then also always make sure that there's an exit easily accessible for you. Try to stay calm and show a caring attitude. Don't match threats or give orders. And try to avoid any body language that could be threatening or aggressive. And acknowledging the person's feelings and frustrations. And all of these things, easier said than done. So at the end of the day, if you are unable to diffuse a situation, remove yourself from it, call for help, and always report any incidents. And the most important thing of all, watch out for each other. So some things that we have here both at Kings County and downstate. So we have the metal detectors on both sides of the street. We can always call hospital police on both sides of the street. On both sides of the street, there are icons on the desktop, those two pictures in the middle. The one that says stop violence, that one's at Kings County, and that's where you can click and report an incident. And then on the downstate side of the street, the one with the SQ is the icon that you can use to report an incident. And then at Kings County, we have the flags for violent patients. And then at downstate, we have the strong line safety alerts, which everybody can get if you're interested. And then at downstate, we also have the AVERT active shooter training. And then finally, just in summary, unfortunately, workplace violence continues to be part of the practice of emergency medicine. Everyone's at risk. Verbal threats are the most common, so we have to make sure that we count them as acts of violence. Emergency rooms are especially vulnerable. Reporting is very, very important, and we don't do enough of it. workplace violence can have very significant both mental and physical consequences. And all hospitals should have a workplace violence prevention program, and it should be created with the involvement of administration and employees overall. And that's it. Thank you for listening.